Hello, everyone. Today I'm going to discuss the approach to domestic violence stations. It's a very important approach to master because domestic violence is a sensitive topic and it's going to be a difficult conversation both for you and for the patient. Also, you need to establish a very good rapport with the patient early on in the station for them to open up to you and to feel safe with you. Now, according to the government.uk website, 1 out of every 5 adults in the UK are going to experience domestic violence at some point in their lifetime, which makes it even a more important issue because of its prevalence in the society. And it can basically affect anyone. So it can be a woman, it can be a man, it can be a person from the LGBTQ community. Now, people who are experiencing domestic violence, most often, they don't have the insight and they do not present to the healthcare services with a presenting complaint of domestic violence. But there are some signs and symptoms which should alert you to the possibility of a patient possibly experiencing domestic abuse. So, physical signs like multiple unexplained bruises, black eye, which the patient cannot explain, sprained wrist for which there is no logical explanation, mental health problem like anxiety, low mood, insomnia, nightmares, suicidal ideations, and behavioral signs like the person seems fearful, reserved, and distant. They cancel appointments at the last minute, and they are always in a hurry to go. So they are always rushing. They might, volunteer you some informations. They might tell you that, doctor, I need to hurry because my husband is waiting in the lobby and he has a temper problem. So he's tempered. So he gets really upset when I'm not there in time. So if a person volunteers a statement like that, they might tell you that my partner is short tempered. Then you need to explore, like there and then you need to explore further. What do they mean by short tempered? Um, does this anger ever, does this anger ever convert into physical fight or not? And then you should explore further. So some important points that you should keep in mind while approaching these stations. The first one, do not be afraid to ask about abuse. Okay, because in these stations, candidates fall into a trap because the patient is so, they seem so afraid and reserved and distant that the candidate shy away from asking the question or approaching the topic of abuse. But please do not fall into this trap. And if you feel like a person might be going through abuse, ask about it. Assess the risk to the patient and kids, if any. So, your main task in this station is to pick up on the possibility of domestic abuse. So, the main task is to suspect domestic abuse and then assess the risk involved. Is there any immediate risk to the life of the patient? Is there a risk to any other person involved, any vulnerable adult in the family, any kids, etc.? Also, do not assume that the patient wants to leave their partner immediately and just offer advice and support. Okay. So you should not push the person to leave their partner immediately. It's a really difficult decision for the patient to make. Okay. Your role here is just to let them know that whatever they are going through is domestic violence. It's not a phase, it's not something normal, and they definitely do not deserve it. And you should offer advice and support. You should tell them about the contact details of organizations who can help develop an emergency plan with them. Make sure that they know what to do in case there is immediate threat to their life, but uh, you should not make any decisions on their behalf or push them to make any decisions there and then. Okay. Now let's talk about the structure of the station. So, as usual, introduction and confirming patient details, ask open-ended questions, begin with how may I help you today. They will give you some presenting complaint. It can be, pain somewhere in the body, like abdominal pain, or it can be insomnia, or it can be, you know, um, can be a pregnant patient who tells you that um, I'm having tummy pain, or I have experienced water leaking, and it can be basically any, a physical or mental health complaint. So do the Odipara and Socrates. If it's a pain problem, do Socrates. If it's any other symptom, do Odipara. Exclude some differentials. Ask about past history. Then ask about any medical problem, any allergies, any medicines that they might be taking, and also ask about smoking and alcohol. Smoking and alcohol is important because a person might have started smoking or consuming excessive alcohol to cope with the problem. Now, psychosocial is basically the part where you are going to explore in detail about the abuse. So, in psychosocial, you should start with general questions like what do you do for a living, who do you live with, and then begin to explore the abuse. So, start with something general like do you feel safe and supported at home? When you ask this question, they will not, they will neither affirm it nor deny it, but they will hesitate. Okay, so they will not answer straight away, and you need to gently ask several times before they will volunteer any information. If they still, they don't answer anything, then express your concern. Tell them that I'm worried about you, I'm worried that someone may have hurt you. Okay, or say something like I'm worried that you might not be safe at home. Offer them confidentiality. Tell them that I want to reassure you that whatever you say here will remain confidential, and we just want to help you and support you. When the patient starts opening up to you, then establish the details of the abuse. So you need to know what type of abuse they are experiencing. Is it physical? Is it emotional? Is it sexual? Is it all three? So physical, you should ask, does your partner hurts you physically? How do they make you feel? Do they belittle you or try to control you? Sexual, do they ever force themselves on you? Okay. So now you have established the type of abuse. Now we'll ask about the pattern of abuse. When does it occur? Are there any alcohols and drugs involved? Coping. So have you tried, how are you coping with the situation? Have you tried anything to stop it? And what happened then? Um, Ask about who else is involved. Any other member of the family treated similarly, any children at home? Because if there are, please always remember to ask this question: do you have any children at home? Because if there are children at home, then the management changes. Okay. Please do not forget about risk assessment. So always ask this question: what will happen if you go home now? This is basically to know if there are any immediate threats to the life of the patient. So what will happen if you go home now? Do you have any emergency safety plan? And risk of self-harm as well. Has it all affected you to the level that you thought about hurting yourself? Okay, so this was basically risk assessment. So you need to establish a rapport for the patient to open up to you. When the patient opens up to you, explore that abuse. Ask about the type of abuse that they are experiencing, the pattern of the abuse, how are they coping, did they do anything to stop it? Is there anyone else involved, especially children, and do the risk assessment? All right. After this, you are going to do examination and ask about ideas, concerns, and expectations. Is there anything that they are scared of? Is there anything that they are expecting from you that you can do for them today? And then in the management part, first of all, acknowledge that it must have been really difficult to talk about this situation, and reassure them that it's not their fault. Tell them that no one deserves to be treated this way. And let me tell you, you are not alone in this situation. 1 out of every 5 adults in the UK pass through a similar experience. We call it domestic violence. Okay, so if it's a woman, you can just say 1 out of 4 women, or 1 out of 6 men. But if you can't remember this data, then just set to remember 1 out of 5 adults. Okay. You don't need to suffer in silence because help and support is available everywhere. Now, about the management plan, if the patient says they do not feel safe in going home, then what you can do is you can offer admission. Usually give them temporary, safe space, and then you can liaise with social services and other organizations to give them permanent accommodation and job situation, and so forth and so on. You need to involve your seniors if you are admitting a patient for on suspicion of domestic abuse. Involve your safeguarding colleagues. So in every ward there is a safeguarding nurse. In obs and gynae there is safeguarding midwife who will, carry out the whole procedure of liaising with social services and other organizations, and helping out this patient, and police as well. Okay. If children are involved, then you need to inform social services. But if there are no children involved and the patient, feels no immediate threat, and wants to go home, then you need to develop an emergency plan with her. Tell her to keep her emergency bag, to keep an emergency bag with important documents, some money for public transport and phone, etc., some spare keys, and phone in a safe place. Which they can take and escape if needed. Tell them that you can always call 999 and contact the police if you feel that your life is in immediate danger. I'll give you leaflets with details of organization that can provide help, help and support with house, money, and legal issues. So there are many different organizations. For women, there is Women Aid. For men, there are different organizations. For people with LGBTQ community, there are different organizations. You do not need to remember the name of all these organizations because the examiner know that you are coming from a different system, so you just need to give a rationale management. Okay. So just tell them that I will give you leaflets with detail of organizations, and they can provide help and support with things like house, money, and legal stuff. And also there is a 24-hour domestic violence line, National Domestic Violence Helpline, which you can contact if needed. And also at the end, do not forget the main complaint with which they have presented. If they have presented with pain, then give them some analgesia, address their physical health problem, and that's it. So I hope this was helpful, and I will see you soon in the next video.